Take our lead, let's help you make your mark. Our goal is your satisfaction. Let us show you the way.
During pregnancy, the placenta is normally attached to the upper wall of the uterus. A placenta that forms low in the uterus without overlapping the cervical opening is referred to as a low-lying placenta. It is not a high-risk condition. It often gets better on its own as the pregnancy progresses.
Take our lead.
Is placenta previa painful? Vaginal bleeding after the 20th week of gestation is the primary sign of placenta previa. The bleeding usually is painless. Some women may have abdominal pain during uterine contractions.
Take our lead.
In roughly 9 out of 10 cases, a low-lying placenta resolves on its own and won't be considered placenta previa by the time you give birth. As the uterus grows in the 3rd trimester, the placenta will migrate on its own, moving up and away from the cervix.
Make your mark, take our lead.
If you were identified with a low placenta at 20 weeks, you are advised to report any vaginal bleeding to the hospital immediately by calling the triage line. You do not need to take any extra precautions compared with any other pregnancy.
Take our lead.
Conclusion. A low-lying placenta is not a contraindication for a trial of labor, and the morbidity in these women is not increased. However, women with a low-lying placenta have a higher chance of an emergency caesarean section compared with women with a placenta outside the lower uterine segment.
Make your mark, take our lead.
If the placenta is still low in your womb, there's a higher chance that you could bleed during your pregnancy or during your baby's birth. This bleeding can be very heavy and put you and your baby at risk.
Make your mark, take our lead.
Key points about placenta previa: it causes bleeding because the placenta is close to or covers the cervix. Bleeding with placenta previa is painless. You may need bed rest or early delivery of your baby.
Thank you for watching. Please subscribe and hit the bell notification.